Senator Boozman's comments at the beginning much really focused on the impacts that these legislation would have, in particularly rural areas, and you mentioned that the effects that you saw were aimed at improving outcomes in healthcare deserts. Can you elaborate a bit on that?
Sure. So obviously, increasing Medicaid reimbursement helps in those rural hospitals where they have a higher payer mix of Medicaid patients, but also the telehealth aspects of it as well. Sometimes we can utilize telehealth so that we can use the infrastructure in larger metropolitan areas like Little Rock, Northwest Arkansas, or Jonesboro, to then use those providers to come into the rural areas and see those patients, so that we're eliminating the issue when it comes to driving to a provider, and also eliminating the issue of there not being a provider in that area as well. So kind of come two birds with one stone on that, and that to me I think is really effective in trying to address those deserts, because while we need more providers, we need more people to live in areas, those things don't happen overnight. And so this is a good stopgap, utilizing new technology to bridge that barrier.
So I am the director of the Arkansas Center for Women's and Infants Health. We were developed with a grant from Senator Boozman that he helped support to kind of help support moms in the direct delivery as well as in that postpartum period. We just want to make sure the resources are being delivered, and I think a valuable piece of information that we'll gather from this is what resources do we not have? What are we lacking in the state? And then we need to go to our legislative partners in the next session and say, okay, well, here is the data. I saw that over, in the northern part of our state, we have great access to X, Y, and Z. We don't have any of that in the southern part of our state, and we need to look to see how we can build that. So I think not only will we kind of help families, but I think we'll gather such valuable resources. The fact that 33 delivering hospitals are committing to try to make this experience better, find ways that we can surround patients and families in new and innovative ways, and we have legislators at the table that are taking notes and want to help with that next process. I think that's huge.